to our 1 o'clock webinar today for our Problem Gambling Prevention Positive Community Framework project. And we have Katie Dively with us, who's a research scientist with the Center for Health and Safety and Culture at Montana State University. So we'll move right into the agenda. Thank you.
Thanks, Roxanne. Hi, everybody. Welcome to today's webinar. As Roxanne mentioned, it is being recorded, so for those who weren't able to join us today, they can listen after, or if you heard something that you wanted to go back to, you of course can go back and listen as well. This is my second recorded webinar today, and the first one we had, folks are really busy in the state of West Virginia too, so it is a busy time of year for preventionists. So with that, I appreciate your time today. We will use a very casual style today. So if you have questions, definitely type them in. And Roxanne, feel free to interrupt me at any point if you feel that one of the questions should be answered right away, because I have no problem with that. What we're going to do today is I'm going to give you a very, very high-level overview of the Positive Culture Framework, just basically to set us up with a frame of how we're engaging in this process for this project in Oregon. Now, we have already engaged in a 6-month project, which is called the Phase 1 project, and so I'd like to give you just an overview of that because that sort of tells the story of where we are today. And one of the outcomes of that first phase of the project was our logo or our brand for any upcoming communications relating to this project. So we're going to go over what kind of the background of developing that brand, but also some talking points for you to use in the community about sort of why that brand was created. Then I'm going to give you some high-level kind of overview and steps that we'll be taking in the second phase of this project, which is the next 2 years, and also touch base about what your role is, and then some key next steps. So you can go to the next slide, Roxanne. So just to tell you briefly a little bit about who we are at the center. So as Roxanne mentioned, we are the Center for Health and Safety Culture. We're located at Montana State University, and we're a group of people that come together to serve organizations and communities through research either that we've done ourselves or in partnership with communities. And then we get that information out through training and guidance to cultivate healthy and safe cultures. We work in a variety of topic areas. Obviously, we're here to talk about gambling today. We work in substance abuse, mental health, suicide, child well-being, traffic safety, all sorts of different topic areas, but all of us being here for the same reason, to improve health or to improve safety in our communities. On the next slide is a map of our project, so feel free to go to our website, which is listed there, and click on any of these bubbles if you want to know any more about our projects that we've engaged in the past. These are either community level, county level, statewide projects that we've engaged in. In Oregon, you might be familiar with our work with the Oregon MORE project, so that was one of our statewide projects, which was the development of communication tools relating to underage drinking. But that can just give you a little bit more feedback on who we are and what we've done. The next slide is our framework. It's the Positive Culture Framework with which we engage in all of our projects. The reason I bring it up today is not to cover the framework, but it's really to talk about this green arrow, which is, as you'll notice, in an upward motion, meaning that we're trying to grow or improve health and safety. And gambling is part of that. You know, obviously we want healthy individuals in our state, we want safe individuals in our state, and gambling is a risk behavior. So we're trying to grow protection. And I think that that's important for the frame, to frame sort of some of the conversation that we're going to have today, but also the project moving forward. We're always seeking to grow protection, grow protective behaviors, attitudes, and beliefs in an effort to reduce risk behaviors. We've learned through lots of research about sort of asset-based or hope-based models rather than fear-based models, or models where we're taking sort of a deficit-style approach where we're constantly looking at what we want to decrease and just constantly talking about reductions in risk behavior. Let's talk about what we want to grow and what are the safe behaviors and attitudes that we want to address. For more information, you can go to the next slide, Roxanne. For more information on this framework particularly, you are welcome to visit our website because we have a pre-recorded webinar. It doesn't take long. It's about, I think, 30 to 40 minutes on the framework itself. So if you have interest in the process to engage in this work, the 3 critical skills of leadership, communication, and integration, all in an effort to improve health and safety, you are welcome to listen to that webinar when you have time. Again, I bring that slide up because of our core assumption at the university, which is the positive exists and it's worth growing. What that means is that we believe entirely that the positive exists in our communities and in individuals that we serve, and it's our work, sort of as research scientists, to figure out what that positive is, whether that's a positive belief, attitude, behavior, and seek to measure that and then grow that over time. Again, it's a different sort of model than looking at what's not working and focusing our attention there. It's about focusing on what is working, shining a light on that, and growing that. So that doesn't mean whatsoever that we're not talking about the concerns associated with the issues that we're addressing, and you can go to the next slide, Roxanne, because the concerns are incredibly important. We want to raise both concern and hope about the issues that we're seeking to address. Concern brings people to the table, right? It helps folks in your community engage and understand why they need to be engaged in gambling prevention or problem gambling prevention. So it's not that we're just talking about the positive, it's that we're doing a balance, or we're raising both hope and concern. So when we talk about gambling in Oregon, we know that problem gambling is a serious public health concern. You might have seen some of these statistics before from OPGR. So we know that over 81,000 meet the criteria for a gambling disorder. And for each of those disordered gamblers, we know that many other are affected, right? We've got spouses, children, partners, coworkers that are impacted by their behavior. On the next slide, it also shows that there are a lot of social costs. In fact, over $500 million worth of social costs in Oregon related to the disordered gamblers. That has impacts on the criminal justice system, correction system, of course, human service systems, and the overall economic health of Oregon. On the next slide, we talk about some of the concerns in relation to rates. We know that Oregon 11th graders who did report gambling had higher rates of also skipping school, being in a physical fight, being sad for 2 or more weeks, and also using alcohol, marijuana, or other drugs. So obviously, this behavior is tied to other risk behaviors as well. We also know that 64% of 11th graders had stated that their parents had not talked to them about the risks of gambling or betting, and that's important. We know that parent disapproval and parents talking with their kids about not either gambling or engaging in risk behavior is incredibly correlated with whether or not they're engaged in that behavior. So we want parents to be talking about the risks associated with gambling to their children. On the next slide, we want to talk about the little bit of hope here. Yes, we have great concern because we do have a percentage of our population engaged in this risk behavior, but there's also hope. We know that 43% of the adults across Oregon haven't gambled in the past year, and that 68% of 11th graders didn't gamble in the last 30 days. So there's a bit of hope there. And we know that from the gambling behavior study that most Oregon adults believe that there are harms associated with gambling and that they outweigh the benefits of gambling. That's good. We want that in that direction, right? We want more people seeing the harms associated with gambling than the benefits. On the next slide, we learned that 85% of the adults were aware of treatment that was available for problem gambling across the state. That's awesome. We've got room to grow there, right? We've got 15% of the population that still doesn't know that there's that resource out there. So we have opportunity for messaging there. Most Oregon adults believe that treatment is effective. This is really good too. We want people to know that treatment is effective, kind of reducing that stigma, getting folks that they know into treatment is important. 73% of adults believe that gambling problems can be prevented through prevention. That's great. And that less than 3% of Oregon adults are considered at risk or problem gamblers currently. That does not mean that that's not an issue. 3%, when we put that into real numbers, is still a very large population, or excuse me, a very large number of individuals within the state, and particularly looking at the social costs associated with those disordered gamblers, we know that this is an issue. But it's still good to sort of put it in this cultural lens to see what percentage of our population is engaging in this risk behavior. Thanks, Roxanne. You can move forward. So one of the key pieces of hope that I think is amazing in Oregon is that you guys provide numerous treatments or numerous services relating to problem gambling. We've got prevention, we've got the 24-hour helpline, intervention, crisis respite care, outpatient therapy, residential therapy, and that it's available at no cost. This is a really incredible service and resource that's provided, and folks should know about this. Thankfully, most do, but we need to get this information out there to more folks as well. So as we start to look at, so that's sort of the why. Why are we engaged in this type of approach, and how can we kind of understand the issue and the culture around gambling across the state before we start to look at any key next steps? So part of the Phase 1 project was really about looking at the issue itself and sort of taking in some of our planning work and figuring out what we wanted to do in this second phase. Part of that was growing the capacity of your state leaders as well as other individuals. So you might have joined us for a webinar where we talked about the first phase of that project. So we provided that capacity building opportunity. We also reviewed data sources that existed, so including the student wellness survey or the Oregon Healthy Teen Survey or the adult surveys that have been done. We also looked at the lotteries, resources that they provided in terms of website hits, different websites we've analyzed, and so forth. We also, Roxanne and I engaged in a process of strategy mapping. That means that we took a look at different services offered by the state from prevention all the way through recovery relating to gambling, and we outlined a strategy map, meaning that we wanted to know what are those current strategies taking place from the state so that we know where are there gaps in services, where do we, if any, have duplication in services. So we want to make some decisions based on that map moving forward. Campaign recommendations were provided. If we had the data that was sufficient enough to make a campaign out of it, we would certainly do so in this phase. But unfortunately, we didn't have all of the data that we needed to ensure moving forward with the campaign. So we'll be collecting that in this next phase. But we did have enough information to move forward and create a branding or logo and to pilot test that logo. So we finalized that logo at the end of that project and created some talking points, which is partially what I want to talk to you about today and describe that process. So on the next slide. So you might have seen this logo come through from Roxanne in the past. It shouldn't be out there on any materials yet. But this logo is what I want to use sort of as the basis for conversation here moving forward. So reflect, resource, renew. 3 steps to address concerns about gambling. Visit opgr.org for more information. So on the next slide, I want to talk a little bit about this process. So what we did was we started to get a feeling from our meetings with the state to try to figure out, okay, what was the issue, or kind of what were folks feeling about gambling and the prevention of problem gambling in Oregon? What did we want to convey? What was the feeling that we wanted people to sort of leave with when they looked at this logo or this brand? And when we started to sort of pull out some of those themes, we provided it to a graphic designer who then kind of went back and forth with us on several different ideas that helped us illustrate sort of this feeling that we wanted to generate among people that saw the brand. But we know that that feeling might not be, you might not get that feeling right away, or you might get a different feeling. You might look at this brand and see something entirely different. We know that. We know that this logo is never going to be used without context. We will always be using this logo on a problem gambling piece, so it's not intended to be used by itself. We did read through lots of pilot testing results, and we saw, some folks thought, well, is this related to recycling? Because the word resource is in there, and it sort of looks, it's green, it kind of looks like environmental science. Is it that? No, it is not, and we'll describe sort of how the group came up with these words after. But again, it will always be placed in combination with a problem gambling piece, and we'll provide talking points for you so that you can guide that conversation. It will also be provided along with other logos, such as the OPGR site. That's why you see the site listed, but you also see common colors there. We did that intentionally so it would blend well with other sponsors on any of the pieces that will be developed. And let's talk a little bit about those talking points that we had. developed as part of this process. So on the next page, we came up with, and you are welcome to have these, either I can send these out or Roxanne can send these out if she hasn't already, but these were sort of talking points or questions to foster thinking about these 3 words. And so if you go to the next slide, I'll sort of break down this list for you. One thing that we knew when we started to think about problem gambling was that we really wanted to get beyond just the individual engaging in that behavior. We also wanted to talk about bystander engagement. What about those family members? What about those friends who see an issue, see somebody engaging in possibly a problem behavior, but they don't know what to do? So we really had to look at it from 2 standpoints. We had to look at creating, this logo and future media and messages for not only the bystander, but for the individual. So you'll see the 2 columns relate to both of those audiences. The word reflect. That came up sort of under the notion of the fact that we know that we needed folks to identify their current behavior or the behavior of another. We noted that we needed to have them become aware of it, right? You have to sort of look at your own behavior or look at your own life to identify if something is an issue, and we knew that we wanted that somehow, that awareness somehow in the logo. So that's where reflect came from. So for a bystander, we really wanted them to start to reflect upon, what concerns do you have about somebody's gambling? Or how is somebody's gambling negatively impacting either their life or yours? What worries do you have about a family member or a friend who might be gambling too much? And then in terms of reflection for the person with problem gambling, what concerns do you have about gambling? How is gambling negatively impacting your life? How is gambling negatively impacting those you care about? What worries do you have about gambling too much? So some of these questions were taken from a counselor who does this often. They were also taken from some motivational interviewing techniques. So you can start to see we're just eliciting somebody's idea to start to reflect on their behavior or the behavior of a loved one. We also knew on the next slide that we wanted to promote all of the resources that were available. So now if somebody recognized that they or a loved one had an issue with gambling, we wanted them to understand what resources were available. So for the bystander, we wanted them to know that there were free, readily accessible resources available online, that there was specific guidance. I mean, that website is beautiful. There's specific guidance for them on how to address concerns about somebody's gambling, and that they themselves could be a resource. They just needed to check out the website and engage with that person and be that resource. For the individual who is perhaps gambling too much, we wanted them also to know that there were free, readily available resources on opgr.org, and that there was specific guidance for them to address their issues, and that individualized assistance was available at no cost. So we've gotten them to reflect on the behavior. Now we realize, okay, there are resources available. This is another key message that we wanted to get out. And lastly, renew. What we were hoping to achieve by the word renew was the understanding that folks could renew their lives, that there was sort of renewal or rebirth after possibly treatment or having this conversation with another. So for bystanders, we wanted them to understand that people are able to overcome problems with gambling and that they can make a difference in their life. Basically, that there's hope, that treatment works, people go through it, and they can come out on the other side. And for folks who are possibly gambling too much, that people, again, are able to overcome problems with gambling, and that this is an opportunity for them to improve their life. So I hope you see sort of our train of thought there of the reflect, resource, and renew. And now that you see this and you start to see some of these talking points or these kind of guidance questions that we were hoping to provoke with folks when they saw this brand, hopefully you can continue that conversation with community members or other prevention professionals in your community. The next slide shows a style guide. And basically what this is, it means that we want to protect, that logo as much as we can. That is a logo that now belongs to the state, and there are requirements on how to use it. Basically, it's, what fonts do you use, what color, what are those color codes that you want to operate by? If you're using it in black and white, how do you do so? What are the file fonts? Basically, all of that information is going to be in this style guide that we will provide you as well, just to know, so you know how to maintain fidelity of that logo. So that wraps up our first phase of the project, and that's sort of where we ended back in June. And we always knew that that first phase would hopefully lead to a second phase, the larger, longer-term phase of this project. So the goal of phase 2, which we're in right now, is to utilize our framework's 7-step communication process, so a process that engages 7 steps, to assess the attitudes and beliefs related to problem gambling in Oregon. So, sorry, Oregon's written twice there. So that effective tools and media can be developed to reduce this risk behavior. So we're talking about, okay, how do we assess the current culture in Oregon related to gambling? And by culture, I mean those current values, attitudes, and beliefs and behaviors related to problem gambling. And then how can we develop some tools for all of you to use so that we can reduce this risk behavior? So that's the ultimate goal. What does this look like in terms of what we'll be doing for deliverables? Well, the project spans July 1st. So we started on July 1st, and it runs through June 30th of 2019. So we have a 2-year project. Our first portion of this grant, or of this project, is really to build the capacity of key stakeholders. So we will be having quarterly webinars. This is our first of quarterly webinars, and we'll sort of walk you through the process along with, walk you along with us in the process and engage with you routinely so that we get your perspectives as people on the ground doing this work. When the project is near its completion, we will actually get together, all of us, in the spring of 2019, where we can distribute the materials to you. We'll again do an overview of our framework and the project itself, and then give you those resources that we know you're waiting to get your hands on. And then obviously our team will engage in monthly phone calls with Oregon Health Authority so that we can ensure that all of these deliverables are met in a timely manner. One of the other things that we're doing in this phase, especially in this early phase of the project, is that we are going to engage in a short assessment of media channels of problem gambling resources. And what does that mean? Basically, that means that shortly, likely later this afternoon or tomorrow, I will be sending each of you a link that asks you for a little bit of your insight in different media channels that you've used in the past relating to problem gambling. And that helps us determine what kinds of tools maybe have worked. And we also ask questions about what kind of tools do you feel are necessary, like what don't you have that you need that perhaps we could deliver. So we'll be asking you to fill out that short survey, and I'll send that to you later on. In terms of other deliverables for phase 2, we're also going to engage in a survey. Now, this is a survey of Oregon adults, and it's about their attitudes, beliefs, and behaviors related to problem gambling, as well as that intervening behavior, that very key behavior of intervening with a problem gambler, and also the statewide resources available. So we really want to know 3 things, right? We want to ask them about their attitudes, beliefs, and behaviors, but as well as their feelings or their willingness to intervene with somebody, particularly a loved one, that might have some problem gambling behaviors. And then we also want to know, do they know about the statewide resources available? And if we're finding that there's a gap there, then we know sort of what direction to move in. This will be an online survey that's completed before the end of the year this year. And so we will be purchasing lists and developing that online survey and administering that here in the next couple months. We will obviously then do all the survey analysis and provide reports, and we will definitely share those reports with Oregon Health Authority, and as they like, they can certainly share those reports with all of you, particularly a key findings report, which sort of explains the data a little bit more than just those tables and charts. Another thing that we're going to look for you to assist us with is the qualitative assessment of key stakeholders and actually probably not all of you, but a random sample of you. And we're going to do this 2 times. We want to better understand your attitudes and knowledge and skills relating to problem gambling, and then we want to do it again after the training that we do in the spring of 2019. So we're seeking to assess some of your thoughts and ideas about gambling and about the resources available, and again, we're going to do that in about 2 years. And then kind of the fun stuff. So our team, after we analyze all of the data, we put together behavioral models and we start to see what are the key attitudes, beliefs that are aligning with those that are engaged in either maybe higher risk-taking behavior like problem gambling, or what are those attitudes and beliefs tied to somebody who's more willing to intervene, because those are where we start to figure out what our messages and what our tools are going to be about. Because we certainly want to use a scientific behavior change background in order to create these tools, and so we'll do lots of different regressions of the data to figure out what these each of these media pieces sort of will get at. In all, you will receive a variety of different things: video, radio, print, PowerPoint, speaking points, and press releases. Now, if you all tell us in your assessment moving forward that there's something else that you really need and other folks are saying it as well, then we'll do that as well. So this is, up to negotiation. We really want to create something that's meaningful for you and that will work in your community. These were just the things that we had proposed creating. And again, it's a sort of a two-pronged effort. It's about decreasing the number of those that are engaging in risk behavior, but it's also about increasing the number of those that are intervening with an individual. Phase 1, Roxanne and I worked together on a communication plan. Basically, that was a template for all of you. If you were to receive all of these materials, would you have the tools available to create a communication plan on how to distribute these resources? So Roxanne and I came up with a sample communication plan, and we will distribute that to all of you, but we'll modify that first if it needs to be modified based on the tools that you all want. And so we'll put that into a sample communication plan that you could consider using as you start to release these tools in your community. We definitely want to pilot test all of these materials first. We want your opinions, so we will test this with key stakeholders at the state, but also with all of you, so you will see down the road when we're developing these materials, you'll see different survey links from me to engage in pilot testing. And then we'll also do a random sample of statewide folks again for pilot testing so that we get sort of outside of that gambling prevention focus area and really engage with the general audience. As I mentioned earlier, we will convene a spring training in 2019, and that is where you'll not only get sort of up to date on what our framework is and how the background of some of these tools so that you have a better understanding of the tools, but this is where you'll also get those tools. And then after that, the second round of qualitative assessment, or those interviews that we'll be engaging with all of you coordinators. And then at the end of the contract, we'll provide guidance for future evaluation. So, okay, great. Now I have all these tools. How am I going to evaluate whether or not they're effective or not? So we'll give you guidance on how to do that.
So Katie, I want to just jump in here. And if we go back up to this area here, the communication plan, revision, and distribution, one of the things that we're looking at is to use that communication plan once these materials are available. So we're looking at this sounds really weird to say, but the 2020 to 22 biennium, using that communication plan to demonstrate how you would utilize the tools and be able to request additional funding to implement those resources. One of the main feedback I've heard about the MORE campaign was that though many of the tools would be fantastic to implement in the community, that the resources were not there available to do so. So we are taking all of that feedback into consideration, and we'll be looking at using a communication plan to help drive how those additional resources could come out to the communities who would be wanting to use the resources that are going to be developed through this phase 2 of the project. So just wanted to add that in there so that folks were aware that we are definitely taking that into consideration about how will this be implemented at the ground level, as well as we are still in the process of developing our partnerships at the state level to look for additional resources to help push the campaign out further. So just wanted to add that in. Okay, Katie.
I appreciate you saying that, Roxanne, and for all of you on the phone, please understand that that is so very true. Roxanne has been mentioning this all along. On every phone call, she is very keen to ensure that these materials are going to be, they're going to be useful to you and that you're actually going to be able to distribute them. We don't want to get into a situation where these great tools are available for you, but you don't have access, meaning you don't have the resources to distribute them in their community, because that's not good for anybody. So she is definitely keen on getting everybody's input and involvement and ensuring that we can work somehow to get these materials out. And yes, if it is that 2020-2021 biennium, so be it. But we want to have everything in line, in place for that period. So let's talk a little bit about your role. So where do you fit into this big picture? Obviously, there's a lot of work sort of on the backside of things where we're working with the state to collect the data, analyze the data, put that into strategies through communication. But you guys also play a really critical role in this, and we wanted to be sure we shared that with you today. So as I mentioned, I will be distributing either later today or tomorrow an online survey relating to media channels. Now this is going to ask you, like I said before, either different media channels that you've used in the past, whether that be, boy, I really like using the radio. The radio is great for us. Or boy, I only use posters. It's sort of checklists that you can start to help us better understand what you use in your community and what you think works best in your community, and also what do you think is missing in your community that you haven't had before but you feel that you really need, because we want to take all of that information and create for you the most the most productive materials. We don't want to create something that you're not going to use. That's a waste of time and energy for all of us. So we want to be sure that we create something that is useful to you. The next thing is the assessment interviews. Now you will be hearing from us probably November is my guess, relating to an interview. Now we will be, because there is a large group of you throughout the state, we will be taking sorry about that, folks. My phone got tangled up. But we will be taking a sample of all of you to engage in some qualitative interviews with our team. As I mentioned before, that'll be about your attitudes, beliefs relating to problem gambling and the resources available throughout the state. And then we'll do that again after the 2-day training in in spring of 2019. So that's another opportunity to become involved. And then everybody absolutely has the opportunity to become involved in pilot testing. We will definitely want to hear from you on this. You will be hearing from me with probably Qualtrics survey links to provide your input. You can always send those links out to other folks if you have community coalitions or other stakeholders that you want to send those links to get their opinions. You are welcome to send those out to anybody. The more the merrier. The more feedback that we can get, the better the materials become. So please always know that when I send you a link. And then ultimately, the goal is to get this information out to your communities, because when folks start to see those messages, we only create the messages that are tied strongly to behavior. That's what our behavioral models are for. So the more we can get these these pieces of information out to the community, the more we are able to reduce that risk behavior and improve health and safety overall. So the more distribution that we can get, like Roxanne was saying, the better. And we want to be sure that you guys have the resources to do so. So with that, before we wrap up and allow some time for questions, I did want to talk about, again, we'll be having quarterly webinars. And our next webinar will be on December 6th at 11 a.m. And the topic will be the communication 7-step process. So if you're starting to figure out, well, how the heck do they create these materials? What is the process for that? I'm going to be going over the communication 7-step process. It's not just a process that we use for this particular project, but it's a process that we use in all of our communications. So if we're creating, yes, a media campaign, obviously we'd use this process. But if we're actually scripting a radio ad, or if we're scripting an evening, a town hall meeting or something like that, we use the 7-step process all the time. So you might watch it and you might say, hey, I could use that process, and we can certainly send you some more tools on how to use that process after watching that. So lastly, I just want to open it up and see, Roxanne, have you received any questions in the chat box, or are we able to unmute folks if they have any questions at this time?
I'm not currently seeing any questions in the chat box, but so if there is, if you'll raise your hand, I can definitely unmute someone if they have a question at this time. I'm not seeing any hands raised at this point or any questions, so I think we must have just thoroughly just given them everything they needed today.
Hopefully not quite the opposite.
Right. So again, please also, if you have questions or concerns, hopes or dreams that you would like to make sure that we're capturing here, go ahead and send those to me, because I definitely am looking at the feedback that we get along the way. The other piece is that definitely take the opportunity to fill out the surveys that Katie will be sending out to you, and participate if you are part of the random sample in the interview process, because that's really going to help shape our project and ensure that we have your voice included in the progress all the way around. Looks like I do have a question now. Oh, nope, not a question. We were very clear. So with that, if there isn't anything else from the group, we'll get you done early today and send you along your merry way to do all the important things that I know that you have waiting for you in your community. So Katie, if you want to hold off for a few minutes, I'll stop the recording, but we'll let everybody else go. Oh,
Great.
looks
Thanks,
like maybe
everyone.
double check. Yep, great. Okay, thank you guys. Okay, so I've stopped the recording. So, oh, looks like we might have had another question here. Nope, just everybody chiming in, thanks. So, I think with that, we're pretty good, Katie. So if you'll just let me know anything that you're going to need from me.
I will. I think I'm good right now. The next thing that we'll probably want to discuss, but I need to check in with my team first, is how we're going to get that random sample, and if we want to then have you have a glance at it to be sure that we are fully kind of geographically representing the state.
Okay.
But we'll talk about that when we're ready. I need my team we have a meeting about it next week to start to think about how we might collect that. So
great.
But otherwise, I will be sending out an email probably later today.
Wonderful. And I will be connecting with you again on October 4th then.
Okay, sounds good. Thanks, Roxanne.
Okay, thanks.
Bye-bye.